What's up guys, and welcome back to my channel. In today's video I am going to talk about my first week into clinical practice as a student registered nurse anesthesiologist. So if you are just a nurse or somebody just willing to learn and have different other people experience, you are at the right place. So don't forget to click like and subscribe, also share. So yes guys, I've been through 4 semesters already, and now this is my 5th semester into CRNA school. Oh my god, I'm so grateful. And now because my program is front loaded, it's time to hit the bedside. Yes. And one thing I was anxious about is because I've been a nurse, an ICU nurse for so many times, and now I have all these skills sleeping in me because I've been in school for 4 semesters, right? So I had many questions into going into the clinical practice because I also had to move at one point. So going into a different state and not being familiar with the hospital I was going to was just raising up my anxiety. So one thing I did before anything else is that the day I retrieved my badge, my student badge for access into the hospital, I went ahead and I made myself a tour, and I allowed myself to get lost in the hospital just to, know my way around. And still it wasn't possible because the hospital where I do my clinical rotation at the moment is huge. So we had a day for formal hospital visit where we discovered the site and everything. But one thing that made my first week rotation was, first of all, the anxiety. Just being in that new environment after taking classes for almost 4 semesters, right? Had to wake up early in the morning and making sure I'm at the hospital before my preceptor, and then trying to look up the case the night ahead and setting up my room, making sure that I have the right dosages on all my medicine. So all these things were just a source of stress. And also, let's say in the middle of the case, my preceptor had to send me to pick up something where I don't know where it is and it's something urgent. Yes, my anxiety was spiking up. But I had a lot of support. I came there early and ready, especially because I had the opportunity of looking up my cases the night ahead. I made sure that my care plan were done and that I had the right medicine and that I was able to answer some questions. But this is the thing, you are never ready until you physically be in the case. Why am I saying that? Sometimes the assignment will change, so the patient you read about will not be the patient you will actually help on with your CRNAs. Sometimes they might have questions that you don't know or that you never came across during the didactic portion. So you want to be willing to learn, you want to be open to learn. And sometimes, things that because of the stress, your brain just go black out. So yeah, it was a painful experiment, and it's still painful. I'm still trying to find my way. So one thing I want to say that really helped me is the fact that I was setting up myself for success. So looking up my cases the night before, getting there early so I had time to get lost and just ask questions to different people, having time to set up my room, and also be open to learn, be open to have your preceptor criticize you or just put out some remarks there. They were all welcome to me. So yeah, and like I said, the way I tried to find my way in a hospital, because the OR was just huge and it has like different sections there and there, I just like, I was having my marks, like, okay, if I see this here, and that's the way to get to this place. So that was kind of things that I was doing during the first week. And coming to clinical cases, the first week was really an active observational week. So this is the week that from my first preceptor, I really started to put into practice the things that I have been learning into school. Like with the intubation, they did not allow me to go straight into the direct laryngoscopy, but I started my intubation with the glidoscope. So until I was able to go in with the glidoscope while verbalizing the anatomy structure that I was seeing and what could be the potential like injury or risk, yeah, until then they wouldn't allow me to do the direct laryngoscopy. And I'm so grateful, because every single night that I will do the glidoscope, I'll come back home and read on all the anatomy, the innervation and the vascular structure in the area. So it really helped me, and it's also again really helped me understand the airway innervation, right? When you get questioned on the spot, sometimes the things that you learn that way, just like, okay, up in the air, you're just learning now. Clinically, you are able to apply them. You are able to see how relevant they are in your practice. So it really helped me reinforce that part of the material, and it really helped me trust more on myself.